I'll start off with talking about two of our infection prevention tools that we created within our unit. So, one of them is our congregate care playbook for COVID-19. With the Institute for Healthcare Improvement, we were able to quickly create this playbook. And each play in this book is designed to help deliver a win through highly coordinated teamwork by outlining best practices for COVID-19 management and infection control and facilitating proactive training. We also have an infection prevention binder. So this actually started as just a binder of infection prevention checklists and tools that one of our local hospitals created. We took that initial version and then we used that as a foundation and made it more accessible to various types of facilities. And we developed into an actionable format. We added a collection of resources and county information. The purpose of this was to support long-term care facility, and topics covered included PPE, donning and doffing, as well as clean and sanitation. We also provided these resources in Spanish.
We are in a very rural area. We have very few long-term care facilities, very few hospitals. But what we do have, we have a lot of small facilities that have maybe 10 to 15 residents. We also have homeless shelters and other congregate living facilities that are really small. So we started to develop a tool that is not necessarily just for people that are in the healthcare field, but also for people that are in need of these guidances, but do not really qualify to be overseen by CMS or any other entities. It's a binder that is divided into different sections, and each section has basic information, resources, and suggestions. This is going to be translated into Spanish for our Spanish community. We are in the Southwest. We have a lot of Spanish-speaking natives here.
As we started this project, Sarah went out and started doing some of these large assessments that are set up for the different types of facilities. So she did a couple of ICARs for some smaller long-term care facilities, and we identified that these facilities aren't required to have the same infection prevention knowledge base that a larger facility would. Places like our homeless shelter and our halfway house and our jails just don't have that type of capacity. We realize that these are the places that need this knowledge, and they need it in a form that they can understand, that they can easily read, that they can easily make changes in their facility or watch for different problem areas easily and quickly.
One of the greatest successes really was how we have transformed in our county our relationship with these types of facilities and the communities that work with these facilities. I don't think we can ever go back to sort of the status quo of how our public health department interacted, mostly in a telephonic regulatory way with these facilities in the context of their responsibilities to investigate outbreaks at facilities and report them.
A lot of the success was due to collaboration. We worked with community organization and advocates for the elderly. This collaboration with them really helped us as a health department. There was a large amount of facilities. We couldn't have done it all alone.
The greatest successes have been getting into these long-term care facilities. We live in a very small area. A lot of places feel like they have to do the work themselves, and they don't always reach out for help. COVID has changed that picture quite a bit. Places are now reaching out to the health department and public health across the board.
Having a broader vision of what types of facilities and care environments should be included in your healthcare delivery community, and understanding that even if places aren't healthcare facilities, they are providing care that is going to impact the well-being and morbidity, mortality of these most vulnerable populations.
I would do it the way Sarah did it. I think she did an amazing job of reaching out and getting the larger assessments done so that people could see, the administrators, the people who were leading the charge at these different facilities could really see that they knew a lot, but there was so much more that they could identify that may need some assistance. Like, oh, I hadn't thought about that kind of moments.